We didn't do this. Okay. So this is so the last thing we talked about was hormones and the fact that the presence of them can sometimes elicit a neoplastic response if you have the receptors on the cells that respond to them. And the primary example of that, for females anyway, is estrogen stimulation of the mammary tissue to produce neoplasia. I mentioned this earlier on in the class, but ovariohysterectomy and the incidence of mammary tumors in dogs is very strongly correlated. So if they're spayed before their first estrus, the incidence of disease is 1 in 100. If they're spayed after their first estrus, the incidence drops to 1 in every 12 dogs. And if they're spayed after the second estrus, it's a 25% chance that they will get neoplasia. Yes.
So I've seen some articles recently talking about how spaying at like a year for females is better for cancers that they would get when they're older, like to prevent those cancers.
Maybe cancers other than mammary
Yeah.
neoplasia, that's possible.
Okay.
That's
Because
possible.
a lot of breeders are now putting into their like contracts, like AKC puppies, that you have to wait until the female is 10 to 12 months to spay her.
Yeah, there's a lot of information out there. As a veterinarian, I recommend spaying the dogs. These cancers, I mean, I see them all the time. And as a pathologist who sees this constantly. And I'm not sure of the article you're referring to about maybe estrogen. And estrogen does have protective effects. That's known. That's why women, you don't necessarily want to get a ovarian hysterectomy if you can help it because of the beneficial effects of estrogen. So there's always going to be pros and cons to anything that you do. And there is, as I was telling someone else, there are other sources of estrogen other than the estradiol produced by the ovaries. So you have to keep that in mind as well. There's estrogen from various sources throughout the body. So this is just one form of estrogen, the most potent form of estrogen and the most abundant. But even when you spay them, it's not like there's no more estrogen there to have any protective effects on the bone or to have any protective effects on cognition. So it's just a balance thing, and you determine what's the least harmful. So in my mind, because of mammary tumors, and there's other estrogen-associated neoplasias out there, but the main one we're worried about is mammary tumors. It's not worth the potential for the potential beneficial effect for something else when you know that it's strongly correlated with this. That's my opinion. And of course, if you're gonna breed, you breed, and you just know this is something that can happen, and you look out for it. And so, nothing bad about not spaying, but if you're not gonna breed, why take the risk? That's my viewpoint. Don't need to know these. Just showing the various types of mammary tumors. If you see the word, so a lot of times you'll see simple mammary adenoma or simple mammary adenocarcinoma or complex or mixed. Those are going to be your 3 most common kind of prefixes or pre-words before mammary tumor. So simple means it's just of one cell type, with that cell type 99.9% of the time being the epithelial component rather than the myoepithelial, but you can have a myoepithelial tumor. But so if you see simple, it's just a neoplasia of the epithelial follicular cells of the gland. Okay, if you see complex, that means you have both epithelial component and a spindle component, and that spindle component is going to be your myoepithelial cells. But just know that's what that term means. And if you see mixed, which we showed examples of, that's when you have some other cell type, usually bone or cartilage. Okay. Okay. Yes. Simple is just one cell type. And usually that's going to be the epithelial cell type. So you just have like sheets of glandular epithelium or well-formed tubules of glandular epithelium, but the surrounding myoepithelial cells are not proliferating or neoplastic, just the epithelium. Simple mammary tumors tend to be more aggressive than the others. So prognostically, if I see a simple mammary adenocarcinoma, I'm going to warn that this tumor may behave more aggressively than its complex counterparts. Okay, so clinical effects, a lot of this is kind of self-explanatory or understood. But, so you can have atrophy of the surrounding cells. Usually you have, well, you can have that with infiltrative or expansile. You can get obstruction of the lumen or of organs, tissue destruction, particularly with malignant neoplasms that invade, destruction of the blood or lymph supply, destruction of the nerve supply, bacterial, I want to make sure my phone was off. It's not. Bacterial invasion of the neoplasm can occur. A lot of times, particularly if it gets ulcerated, you'll have secondary infections, emaciation. That's a huge one. And the reason I say that's a huge one is because a lot of times, I've seen this at least twice, where an animal had cancer, but the owners were suspected of abuse, neglect, malnourishment. One was here with a horse. There was a very emaciated horse that came in, and a student went and called, whoever they called to report the owner, and then the student found out the owner rescued the horse, and the horse had cancer, which is why it was emaciated, not because it wasn't being fed. And then there was another case, yes.
In that instance, it's not in the scope of class, I guess, but don't you have to talk to a superior and be like, hey?
So of course the student was wrong. The student didn't know. The student was so emotional, and what happened? Of course, you shouldn't make assumptions because something appears a certain way. Never talk to the owner, but also as a student, that's kind of not your place. You could go talk to the clinician, and the clinician would do that. So she was just out of line. But it's a reminder, don't assume the worst until you know, because you could be falsely accusing people of stuff. And the other instance was on, it's something that used to come on where the people went and knocked on the people's doors for abuse. Animal cops, I think so. It was a woman, she had a ponytail. I don't know, it was a long time ago, but it was one of those shows. I don't know if it's Animal Cops or whatever. No. Yeah, that's what's coming to my mind, so it's probably right. But she went to this owner because someone had reported, this animal, very skinny, not being fed, and found out the animal had cancer. And the animal was being cared for very, very, very well. And so the reason you have emaciation with neoplasia, it really doesn't have anything to do with malnourishment, but it's because a lot of neoplastic cells secrete cachexia factor, and so it's the production of that hormone or that protein product that causes muscle wasting, which is why cachexia is frequently a feature with cancers. Anemia can occur. You can have hormone production. It can either be normal hormones that cell population normally produces, or it could be aberrant hormones. And when that happens, that's called paraneoplastic syndrome, which we mentioned before. We're going to talk about that in a little more depth. Okay, of course, death is a clinical effect, and sometimes tumors spontaneously regress or recover, or they go into remission. So it's not always, destined for death. So clinical features, basically kind of what we said. You can have clinical abnormalities associated with the organ affected. So if you have a liver neoplasm, you expect to have liver findings, liver abnormalities. What does the liver produce?
Everything.
Everything. So you have decreased coagulation factors, decreased albumin.
Edema?
Yep, edema. Y'all know the different forms of edema? Like what causes it? So one is decreased protein or decreased oncotic pressure.
Vascular obstruction.
I heard.
Hydrostatic.
Hold on.
This is on the
Okay, I'm gonna pick someone I haven't talked to before. It's good. It's all good. Tracy Mandrona. Is Tracy here? Hi. How do you say your name?
Good, how are you?
How do you say your name?
Mandrona.
Mandrona. Okay. So, are you Hispanic? Because it sounds like a Hispanic name. So I didn't know if I needed to roll an R. Where are you from?
Well, I'm from New Jersey.
Oh, okay.
I mean, it's Russian, but
Ah.
Oh.
Is anybody else Russian? Okay, Tracy. Well, while I have you, is there anything you'd like to share with me in the class?
well, I'm from New Jersey, and I ride horses.
Awesome. So you're a horse person. Horse people. So you like horse. Do you know what type of veterinary medicine you want to practice?
Equine repro.
Okay, cool. Are you friends with Love Lady?
Yeah.
Okay.
down there.
Let's see if it's a repro guy. Alright, cool. So, Tracy, do you remember the 4 types of edema? Or the main causes, general causes? Do you remember one of them?
Lymphatic blockage.
Okay, lymphatic blockage. Very good. Alright. Keila? Or is it Kyla? Keila? Keila Martinez Medina? Kayla, Lord. Kayla, that's you. I know your name too, but I didn't know you spelled it like that.
Yes.
Ah, okay, Kayla. Is there anything that you'd be willing to share with me in the class?
Yes,
about
I
yourself?
used to be in a marching band since I was like 14, 13 until I graduated school,
Like college? So are you,
I used to do water polo, but it's too cold to do water polo or swim right now, so.
what kind of marching style? So what is aerial? What'd you ask?
Ask me what marching style is.
What marching style? There's different marching styles?
Yeah.
You mean like,
There's traditions and you got
yeah, you mean like one type of band versus another type of band? So where did you go to school? Okay, so yeah, what kind of marching style did you do? Like
We used to
slow?
do everything. I don't even know. We used to do every single thing, field shows, orchestra, everything.
Oh,
We did everything.
wow. Cool. So from Puerto Rico, do y'all do like Puerto Rican style salsa music in the band?
I don't know how to dance salsa. I'm ashamed.
she got kicked out of Puerto Rico.
But like, is y'all's band music like what I consider Hispanic music?
We
Like,
tend to mix like different music, new music, old music, classic.
oh wow. Do you have a video on YouTube or something? I really want to know, like I never thought about Puerto Rican bands. That's really cool. What instrument did you play?
Alto saxophone.
Ooh. So, okay, who else played an instrument in here? Look around. Oh my God, y'all Okay, and I remember, y'all know Jorge Irizarry? He plays band. He used to be in a band in high school. So there you go, that's a fun fact about him. So y'all could all, okay, sorry, I totally got sidetracked. But I have another question. How do you play water polo?
Basically, it's a very weird way of swimming because you have to like make a whirlpool with your legs to stay up. So it makes you very tired, but
So it's not where the people do different
It's like soccer, but in one.
It's an Olympic sport too. You should watch it.
Yeah.
It's actually-
I've heard of it, but I have no idea what it is. Okay, so I learned a lot today. So Kayla, can you tell me a second type of edema? Or cause, general cause. So we have
Low oncotic, what did she say?
She said the.
lymphatic
Low
obstruction,
oncotic pressure.
decreased oncotic pressure. And we know oncotic pressure comes from
Protein.
proteins. And the most common protein is
Albumin.
Good. All right. It gets harder as we go. See, I'll pick the easy one. Pedro, wait, why am I picking all the, okay, hold on. I was doing it on purpose. Chantel Simmons. All right, Chantel, is there anything you'd be willing to share?
Okay, I graduated from Clemson University, which is the best university. Also, I showed a chicken while I was in undergrad. I did a little band.
So you showed him, like,
Showed him like
against other chickens?
it was actually against all the farm animals, and he won third place because he was amazing.
Esteban?
Yes.
Like, was he your personal chicken?
Nah. So I didn't farm.
Very cool. I went to the goat show like 2 weekends ago. Y'all should go. It's pretty cool. Like, they have it down here.
I showed goats before.
Yeah. They have like kids like 5 years old with a goat bigger than them, and they are on point. Yeah. It's cool.
The small animal fair was on.
Yes, that day, it sure was. And I had to decide, so I went there, because I already committed to going there. Okay, Chantel, can you give me a third form of edema?
Increase hydrostatic pressure.
Increased hydrostatic pressure. Very good. Okay, the other one is the one a lot of times people don't get. Does anybody know it? So raise your hand.
Salt.
Isn't it increased vascular permeability from histamine?
Yes, ma'am. Very good. So we really call it, and it can be from histamines too, but the general classification is inflammatory edema. So it could be just from inflammation, where the vessels need to become more permeable, so fibrin and cells can get out. From inflammation from mast cells due to anaphylactic reaction. So perfect. All right. And we talk about that a lot. You'll see edema. The reason that's so important and clinically important is because you'll see edema a lot. And then you have to be able to narrow down what is causing this edema. Is it heart failure and passive congestion and increased hydrostatic pressure? Does the animal have decreased albumin? Do we need to, we need to do clinical chemistry? So that's the reason why I spent that time on that. It really is important. Okay. Now where I was to make me say that, I really have no idea.
If you have liver cancer, what can that cause?
That's what it was. And then I thought about decreased protein, and then that's where that came from. Okay, so we've already talked about cancer cachexia. Of course, you can have outward lesions. You have a tumor growing on you. You can see it. And paraneoplastic syndromes. I don't know if it's neck, yeah. So I'm going to spend a little time on the paraneoplastic syndromes because that's an important concept to understand. And we're going to go over a few characteristic paraneoplastic syndromes. So paraneoplastic syndrome is a systemic complication or illness of neoplasia that is remote from the primary tumor. So it's something you kind of don't expect to be associated with the tumor necessarily, okay? It can represent the earliest manifestation of an occult neoplasm. So that's important to know. You may not see a tumor, feel a tumor, have any reason to think there's a tumor, but you have this response going on. And we'll talk about some of those responses. And knowing what some of the characteristic paraneoplastic syndromes are will lead you to know, oh, what if this animal has, pulmonary neoplasia, okay? Paraneoplastic syndromes may confound treatment if you're not sure what you really need to be treating. And the paraneoplastic syndromes themselves can cause illness and death of the patient. And the cool thing is when you remove the inciting cause, the paraneoplastic syndrome goes away. which is kind of what I just said. So product concentrations, whatever that product may be, is maintained after removal of the normal gland that controls that product. So characteristic example is hypercalcemia of malignancy. Maybe you think this animal has hypercalcemia because there's something going on with its parathyroid glands. You remove the parathyroid glands, but because that wasn't the problem in the first place, the calcemia is still elevated, okay? Concentration of the product, example, calcium decreases after removal or treatment of the neoplasm. So it's the neoplasia that was responsible, not the gland that normally regulates calcium. And synthesis and secretion of the product can be seen in vitro by the tumor. So if you do some test to see if that product is there, it will be because it's the tumor producing it. Okay, so there are various categories of paraneoplastic syndromes. Some of the more common ones are endocrinopathies, such as hypercalcemia of malignancy, where the neoplastic cells secrete parathyroid hormone like protein, or you mostly see PTHRP, parathyroid hormone related protein. Cushing syndrome, what's Cushing's? Hypercorticism, so some cells can produce adrenocorticotropic hormone and make it seem like you have Cushing's, or you do, but it's due to the tumor. Neuromuscular disorders, there's various different types of tumors that can cause like neurodegeneration, dermatologic disorders, osseous, articular, soft tissue changes. One of the more common ones that you'll see in veterinary medicine is hypertrophic osteopathy, also known as hypertrophic osteoarthropathy. I think I have a picture of that. But that's usually associated with tumors in the